I want to welcome our speaker, Miss Jamie O'Day, RN, IBCLC, and co-founder of NAPS. Hello and welcome back to Kidco Talks,
Hello,
Miss
I'm so
Jamie.
excited to be here, Chrissy.
NAPS guides families from pregnancy through the preschool years with personalized support from experienced registered nurses without judgment. During today's talk, we're going to learn how to properly perform CPR on an infant and child, as well as how to respond to an infant or child who is choking. NAPS is showing hands-on demonstration and expert guidance to ensure you feel confident and prepared in all emergency situations. Webinar participants, we do have the chat open, so if you have any questions, I'll be trying to facilitate that. There is a Q&A function too if you have any questions, and we'll do our best to answer your questions during this demonstration, and if there's any additional time, we'll go over those Q&As at the end. So Jamie, over to you, ma'am.
Awesome. Thanks, Chrissy. Love being here with you all. So excited to be able to teach people infant and child CPR. Couple quick, just housekeeping logistical things from me. Chrissy and I were just talking about this before we jumped on. One, I did put notes in the chat. If you cannot see them, it may be an issue with mobile, no problem. I'm going to send these to Chrissy so that she can send these notes after the webinar. So please do not worry about not having the notes right now. I promise I will get them to you in some way, shape, or form. For those of you who can access them, you don't have to use the notes to follow along, but if you wanted to, you can. So just another thing for you all to take away from today.
Yeah, and just Jamie too, I always
Yeah.
say this at the end, guys, but this recording will be sent out, a recording of it. So I'll send all of those resources with that recording so that you have it, so no one misses anything.
Perfect. I am going to be doing actual demonstration with my dolls that I have here. I have done this workshop, countless times on video like this. So I will hold up the mannequin. I will come in and out of, I have a slides that I'm going to go through. I will come in and out of my shared screen so that you guys can have the full picture of me doing the demonstrations. I do like to tell people this curriculum, the way that we teach it, is based on the American Heart Association's Friends and Family curriculum, which is two things that I want to make note of for you all. One is this is not a certification course. This is truly just what you would need to do in order to sustain somebody's life until help arrives. So trying to keep it super simple, straightforward, so that these steps that I'm going to go over and over again, I hope are more ingrained in your brain and are second nature. So that if there is an emergency, you'll, maybe hear my voice or a variation of my voice telling you what to do. So I am going to repeat myself a million times. That's I'm not losing my mind. I'm not just, a mom of 3 kids who can't remember what she said. I am intentionally doing that so that hopefully these steps become more of a second nature to you all by the end of this hour. By the end of the hour, you will know how to perform CPR on an infant, you will know how to perform CPR on a child, and you will know how to perform CPR on an adult, because if I have you here, I'm going to teach you how to do it on an adult as well. You will also know what to do for each of those groups if they are choking. So those are the things that we're going to cover today, okay? If you haven't already noticed, I'm trying to keep this super informal, casual. Yes, this is a heavy topic, but this is for you all, for your learning. So I want you to ask questions. If you can use the chat feature, that would actually be the best way to go, only because most people tend to have the same questions. So if you see that somebody else has asked it, it's just going to be easier to get through the questions quicker versus the Q&A. If you have more of a personal question that you want to ask in the Q&A, that's totally fine. I'm not saying that you can't use it. But the chat feature tends to be the better way to go, especially for, excuse me, a course like this. I have also been teaching this course for many years, so I try to anticipate a lot of the most common questions that you all will ask. So hopefully I'm getting ahead of that. The other thing that Chrissy and I talked about ahead of this workshop is that I know that I'm teaching this based on the American Heart Association. There is actually a Canadian equivalent, knowing that many of you are joining from Canada. And so we'll happily sort of send that, that website out as a resource to you all as well, just so if you're looking for a course that you can take maybe in person or maybe a refresher course at some point down the line, I want to be able you to be able to have those resources as well. Okay, I think that's it for me. While I'm getting my slides set up, can you all just throw in the chat where you're joining from and how many kids you care for or have and the ages of those kids, just to get a sense of where people are at. I like to give examples that are relevant to people in the group. So please tell me where you're joining from. Would love to know, would love to hear more from you guys while I
We
get
have
my
a
slides.
lot of Edmonton, Oakville, Chicago, Vancouver, Milton, New Jersey,
Oh, Milton.
Boston, Toronto, Calgary, Edmonton, Nova Scotia. Hello, everyone.
Awesome.
Washington.
This is amazing. Well, thank you all for being here and taking the afternoon out to spend it with me. I'm really excited to be here with you all. Like Chrissy said, my name's Jamie O'Day. So I'm a registered nurse. I've always worked in maternal child healthcare. I am the co-founder of NAPS. I'll get into what NAPS is in a second, but I think more importantly and relevant is that I'm a mom to 3 kids myself. So my daughters are 9, 7, and 5. And this is a skill that I wish that every single person on this earth had, so that we can support one another within the community. And I'll get into a little bit more behind the why with that. Quick background before we dive into the actual topics of this class. So NAPS stands for Newborn and Parenting Support. So like Chrissy said, my company at NAPS provides education and care from pregnancy through really like 3, 4 years old. I usually say preschool through potty training. I'm sorry, pregnancy through potty training. So once we sort of like ship that potty trained kid off to preschool it tends to be where our support services ends. Although this class certainly covers a wider age range than that. And so really just doing that through our team of registered nurses and nurse practitioners. So everybody on our team is at least a registered nurse, and really just looking to provide women and families with high quality education and support in this maternal child health space. So really hope that this is a workshop that you enjoy, because this is one that we offer very frequently through NAPS. Okay, so who is this class good for? And I'm not sure if it's all parents on this call, or maybe we have some caregivers on this call as well, maybe some grandparents. But really, I welcome anybody in the community, right? So parents, grandparents, family members, friends, caregivers, aunts, uncles, nannies. This is truly a course for everybody. Anybody who can directly respond to an emergency in a community until paramedics arrive, like this is who this course is for. Okay, so just excited, whatever category you fall into here today, and just really excited to have you here, and just really happy that you've prioritized this. So let's just first break down like what CPR actually stands for. Okay, so CPR stands for cardiopulmonary resuscitation. Okay, cardio meaning of the heart, pulmonary meaning of the lungs, and resuscitation meaning to revive. So when you're doing CPR, there's 2 parts to it. There's compressions and there's breaths, right? So the compressions are doing the work of the heart. This is the cardio part, right? The breaths are doing the work of the lungs, which is to oxygenate that blood, right? That's the pulmonary part, right? And the resuscitation is these 2 things combined, the compressions and the breaths, in order to do the work of the heart and the lungs when the heart and the lungs are not able to do it themselves. Okay, so the work that you're doing during CPR is the work of the heart and the lungs. Now, I want to make sure, can everybody give me like a yes if my slides are moving and you can actually see that I went from my intro slide to who this course is for to what CPR is? Yes. Okay, awesome. Love you guys. So responsive. This is going to be a great class. Okay. I'm going to ask you questions like that hopefully aren't more challenging than just saying yes or no as we go through the class. So please jump right in, answer the questions in the chat so that I can see that everybody's paying attention in here. Okay, hang on, I want to go back. Went back too far. Okay. What do you all think is the #1 reason why people do not perform CPR? Give me some guesses. Maybe you're somebody who's afraid. What is the reason why you're afraid? They're scared, not sure how. They feel unsure, stressed, don't know how. Fear of crushing them, don't know how. Okay, great. Lack of confidence. Okay. You guys are awesome. It's gonna be fun. Okay. So the #1 reason why people do not perform CPR is because they think they're going to do it wrong. Okay. And if you take nothing else away from this class today, what I want you to take away from this class is that bad CPR is better than no CPR at all. So even if you don't think you're going to do it right, or you're not sure how to do it, just do something. So why learn CPR? So I think when people, tell me if I'm right here, right? Like, I think when people think about performing CPR, like they're thinking about maybe like doing it on a stranger, right? Like coming across an accident, or like being a part of maybe something that happened at a community pool or a beach, right? But actually 4 out of 5 cardiac arrests occur within the home. So what does that mean, you guys? If 4 out of 5 cardiac arrests are occurring in the home, then what does that mean for the person who you're performing CPR on? It's not a stranger, right? It's somebody who you know. It's somebody who you love, right? So again, I think that everybody should have this skill, but it's not typically a skill that you're performing on a stranger. Granted, the only examples that I'm going to give you are times where I perform CPR on a stranger, but that's not usually the case, okay? So just remembering the statistics around the people who need it, when and why, right? These are people that are likely people who you know, likely people who you love, somebody who you live with, right? And so that's just another reason to learn this skill. Okay, so let's start with the basics, right? How do you know when to give CPR? Again, if you has anybody here taken like a CPR certification course before, or maybe you are currently BLS certified? Yes. Okay. So when you take a certification course, oftentimes I don't want to say it's complicated by, right? But it's like, we're going to check for a pulse, and there's 1 and 2 rescuer CPR, and they're giving you like an ambu bag, right? We're trying to keep this as simple as possible, right? So at the simplest form, the way that you know if somebody needs CPR is if they're not breathing and they're unresponsive. That is it. Okay. And I'm going to show you how to check for responsiveness and breathing. But if they are not breathing and they are not responsive, then you are going to start CPR. All right. Number 1 question that I get asked at this portion of the course is, what if I perform CPR on somebody who is breathing, who is responsive, but like I missed, right? Like I missed the breath, or I missed like the response when I was trying to get a response out of them. If you start CPR on somebody who was breathing or responsive, but you missed the signs for it, I guarantee you, as soon as you start compressions, you will get a response out of that person. Okay. So kind of no harm, no foul, right? The first compression, you're going to get a response out of somebody because it's going to be uncomfortable, right? But I will teach you how to check for breathing and responsiveness. But at the simplest form, if they're not breathing and they're not responsive, you are performing CPR. Okay. All right. So before you even check for breathing or responsiveness, right? Before you even start performing CPR, the very first thing that you want to do is check and make sure that the scene is safe, right? What does that mean? Again, I feel like if you've ever taken a course before, or maybe watched a video, I feel like what they tell you to look out for is like live wires, right? Like, don't get me wrong. We can look for live wires. I don't want anybody getting electrocuted, right? But like, that's not actually what I mean when I say like, check and make sure the scene is safe, right? When I say check and make sure the scene is safe, it really is, you're thinking about, again, more so, this is likely going to be outside the home, right? But if there was an accident, right? All right, so you're coming up to let's say it's a car accident. Is there a car on fire? Is there glass around the person who needs CPR? Is that person really close to traffic? Right? And if you were to perform CPR on that person, you're putting yourself at risk. So maybe you're coming up onto a person who it could be a suspected overdose. Are there any needles around? Right? It's really, what you're doing is making sure that you can safely perform CPR on that person without putting yourself at risk. Right? So you're looking for anything that may put yourself at risk. All right? That's what you're going to do. Now, once you've made sure that the scene is safe, again, if you're in your home, likely not doing that, right? Usually talking about being outside the home, you've determined that the scene is safe, or maybe you did need to move the victim away from traffic in order to safely to assess them and perform CPR, right? The next thing you're going to do is check for responsiveness, okay? So I'm going to use my baby as the example right now. And remember, you guys, I'm going to come in and out of the shared screen here. So in a moment, your full screen is going to be filled with just me, no slides, and I'm going to show you guys how to do all this. But basically, you're going to like yell at them, baby, are you okay? Tap their shoulders, tickle their feet. If it's if it's any age child or an older child or an adult, you can pinch this area right by their collarbone and neck. If you pinch it and twist it, that can really hurt. and pain would elicit a response, right? So you can pinch right here. You can do what's called a sternal rub and take the knuckles of your fingers and rub it on the chest, okay? But basically you're trying to get any response. Baby, are you okay, right? If they do not move, if they do not make a sound, if they do not blink or otherwise react in some way, shape, or form, they are unresponsive, okay? So then the next thing that you're going to do is call 911, right? Like we've determined that this person is unresponsive. We haven't even checked for their breathing yet because you have an unresponsive person, which means they need help, right? So this is when you're going to call 911 once you've determined that someone is unresponsive, right? So there's a few ways, there's a few caveats to calling 911, right? If you're with someone, right, either in your home or outside the home, you're going to tell that person clearly and directly to call 911, right? So point, say their name if you know it. Prissy, call 911, right? Even if you're in your home and there's only one person there, still say their name. My husband's name is JC. JC, call 911, right? So you're going to point to them, you're going to make eye contact, you're going to say their name. If you are in a crowd of people, you are going to do the exact same thing because there's something called the crowd effect, where if you just yelled, someone call 911, everyone in that crowd is going to assume that somebody else already did it while they sort of like watch on. So you want to say, you point, make eye contact. You can even identify that person, you in the jean jacket, right? Like say the color of their shirt, right? You in the jean jacket, call 911, okay? There have been a whole bunch of studies done on the effectiveness of that. It makes a huge difference, okay? If you are alone and you have your cell phone on you, right? So let's say you're in your home or whatever, you have your cell phone on you. You can call 911 from your cell phone. What's the Canadian equivalent to 911? I probably should have looked this up ahead of time. If you all say 911, then I'm going to, okay. Just making sure this is applicable. Should have looked that up. Anyway, great. So if you have your phone on you, right, you're going to take out your phone, you're going to call 911, you're going to put that on speaker, and you're going to put it down next to you while you continue to assess the person. 911 operators are actually trained in how to teach you how to do, walk you through, tell you through words how to do CPR. Okay. So if you have your phone on you, call 911, right? Put the phone on speaker, put it down next to the person who you're performing CPR or assessing. If you are alone, people get really hung up on this, but trust me, and I'll explain why. If you are alone and you do not have your cell phone on you, you're going to perform CPR and you're going to do 5 sets of CPR. So a full round of CPR is 5 sets of compressions and breaths. We're going to get to that in a minute before calling 911. The reason why you are doing that is because it is only a matter of minutes. Within 6 minutes of no oxygen or blood to the brain is when brain damage occurs. So it's actually more important to reset that clock. Get the blood and oxygen flowing to the brain, right? Again, remember, CPR is doing the work of the heart and the lungs. Get the blood and oxygen back to the brain, right? Then go look for your phone and then come back, right? Once you found it or once you've called 911, okay? Also, if you immediately go and look for your phone, like, again, what only feels like maybe 30 seconds or a minute while you're looking for something that you might not know where it is, can add up to 4, 5, 6 minutes really quickly, okay? So calling 911. All right. So if you are with someone, what's the most important part of telling that person to call 911? If you're with somebody, use their name. Use their name. Identify them. Identify them. Say, if you know their name, say their name. If you can identify them in another way, identify them in another way. You in the blue shirt. Okay. Awesome. Great job, everybody. Okay. All right. So we've checked for responsiveness. Baby, are you okay? Tapping their shoulders, rubbing their feet, doing the sternal rub. I'm not getting a reaction out of them. So now I've called 911. Now I'm calling 911. Now I'm going to check for breathing. In an ideal scenario, when you check for breathing, it would be on a firm, flat surface. So this table is a good place, a countertop, right? Maybe with a really small kid. But the floor is ideal, right? So on the floor, if you can move the person to the floor, that would be ideal, but you have to be able to do that safely. You want to remove any thick clothing from the chest. Again, if they're just like in a cotton t-shirt, that's okay. But if they have a jacket on or a sweatshirt or something like that, you can cut it, pull it off, right? But if you can actually see the chest, that's ideal. You're going to look, I'm going to come out into the full screen in a second when I put this all together, but you're going to look, listen, and feel for breathing. What does that mean? You're going to look with your eyes at the chest. You're going to listen with your ear next to the mouth, and you're going to feel with your cheek next to the mouth for breathing. So we're looking to see if the chest rises at all. We're listening for any breathing, and we're seeing if we can feel any breath on our cheek, right? So look, listen, and feel. I'm looking down towards the chest. I'm looking, listening, and feeling for 5 to 10 seconds max. If you do not see a breath, hear a breath, feel a breath in those 5 to 10 seconds, they are not breathing and they are not responsive. So what are we doing? Not breathing, not responsive. CPR, CPR, CPR. Exactly. Great job. Somebody asked how to check differentiate between breathing and being. So if somebody had a seizure, they are like, don't get me wrong, you can stop breathing from a seizure, but they're likely breathing, right? So this is one of the scenarios that I talk through is you might come up on somebody who is unresponsive from a seizure, but that you're never going to know why, right? Unless you saw the accident happen. So sometimes you're not going to know why they're not responsive. But somebody who's had a seizure and isn't responsive is going to be breathing. If they're not breathing and not responsive, regardless of the cause, you're performing CPR. So if they had a seizure, they're unresponsive because of the seizure, and maybe something happened, they choked, right? And they're not breathing from that, then you're performing CPR. Okay? All right. You guys are doing great. Keep this energy up. Okay. All right. So now we're going to talk about compressions, and then I'm going to come out of the shared screen. It'll be a full screen. I'm going to show you how to check for responsiveness, breathing. I'm going to show you how to do compressions. All right. And then we'll come back to the slides here. So when we're talking about CPR for infants, we're talking about children under 12 months, right? These aren't like hard and fast ages. But to give people guidelines, we're saying under 12 months is an infant. Okay. When we're performing compressions, again, ideal place is on a firm, flat surface. You want to remove any bulky, especially bulky clothing, but clothing from the chest. You're going to place 2 fingers on the breastbone just below the nipple line. What does that mean? That means this is the nipple line. I have 2 fingers, one stacked on top of the other, just below the nipple line. So here's the nipple line. My top finger is just below that. Okay. So we're aiming for the breastbone. Like you can feel your sternum, your breastbone here. That's where you want to be performing the compressions. Okay. You're going to push straight down. I love this, right? All these slides say like the depth, 1.5 inches. All it means is hard. You're going to push hard. There's, I don't want to say there's no such thing as too hard, but there's no such thing as too hard of compressions. Okay. People, when they're doing compressions, inappropriately or not right, it's usually if they're not doing it hard enough. Okay. So you're going to push hard, 1.5 inches down, right? At a rate of 100 pushes per minute. Again, what the heck does that mean? Fast, right? So all you need to know with compressions is you're pushing hard and you're pushing fast. And you're doing 30 compressions and then 2 breaths. I'll show you guys breaths in a second. All right. So 30 compressions to 2 breaths. I know I'm not in the full screen yet. I will. When you are doing compressions, you're going to push down hard and you want to make sure that you take your fingers. They don't have to come, I'm going to exaggerate it. They don't have to come all the way off the chest, but you want to make sure that the chest returns to its normal state before you push down again. The reason for that is, right, we're doing the work of the heart. So you push down, you're compressing the heart to pump out the blood, right? And you don't want to keep pressure on the chest. You want to remove your fingers from the chest or just loosen them from the chest so that heart can fill back up completely with blood before you push down again. Okay? All right. So what does this actually look like? Let's do the full screen. Okay? So again, positioning. This is the nipple line, 2 fingers just below that nipple line. Okay. We're pushing down hard and fast. I'll do a few compressions for you so you can see it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. See how my fingers are just like loosely touching the chest before I compress again? That's what you want to do, okay? So hard and fast, all right? I'm going to put it together just with checking for responsiveness and breathing for you all so that you can see, it's blank. Anyone also seeing a blank? Okay. Can you guys, okay, you can see me. Okay, great. So I'll put it all together for you with the compressions, with checking for responsiveness, compressions, and then I'll go back into my slides to show you guys how to do breaths, and then we'll put it all together. Okay. All right. So I go into my daughter's room. She's been sleeping for 2 hours and we need to get up and go and get my other 2 kids at school, right? So I go into my daughter's room. She's 9 months old. And when I go into her room to get her out of her crib, I realize that like she's limp and she looks a little bit blue, right? So what's the first thing that I'm doing? First thing that you do if you're unsure if somebody needs CPR. We're not calling for 911 yet. We're checking for responsiveness. Check for responsiveness. Yes. Okay. So I'm going to say, my daughter's name is Camilla. Camilla, are you okay? Tapping her shoulders, rubbing her chest, tickling her feet. She is unresponsive. What am I doing next? I'm home alone and I have my phone on me. Call 911. So I'm calling 911 as soon as I know that she's unresponsive. Okay. I'm taking out my phone. I'm dialing 911. I'm putting it on speaker next to me. Okay. Now what am I going to do? I check for responsiveness. She's unresponsive. The 911 is on the line. What's next? Check for breathing. Okay. I'm going to look, listen, and feel, right? Look, listen, and feel. I'm going to look with my eyes to see if the chest is rising. I'm going to listen and feel with my cheek to see if I feel a breath or hear a breath. I check for 5 to 10 seconds. She is not breathing. What am I doing now? CPR. Okay. So she's 9 months old. I'm going to line up my 2 fingers just below the nipple line. And I'm going to push what? What and what? What do we got? Hard and fast. Hard and fast. All right. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay? That's 30 compressions. Good job. 30 times 1.5 inches, then 2. Look at you. Well done, Mike. All right. Good? Okay. Let me come back to my slides. Nope, that's not work. Yeah. Okay. All right. So now let's talk about breathing. So we are present. Here we go. Sorry, it's going to take me a minute to do this each time. Now we're going to do breaths. So anytime that we're doing breaths, okay, we're going to do what's called a head tilt chin lift. All that means is we're going to tilt the head up. We're going to use our palm on the forehead to tilt the head up. We're going to take 2 fingers to lift the chin. All you're trying to do, you all, is get it so that their head is in a natural position, right? So I'm talking to you right now, right? This is how I talk. This is how I breathe, right? If I was to take a sip of something, my head's going to be straight ahead, right? So basically you just want the head in a natural position. So if they're on the ground, their eyes looking up to the sky, okay? So head tilt, chin lift. For infants, okay, you're going to cover their nose and mouth, okay? So you're going to take a normal breath, cover their nose and mouth. I'm going to come out to the full screen in a second. And then you're just going to take a normal breath out. You're just breathing out for like 2 to 3 seconds. So normal breath in, normal breath out. You should see the chest rise when you give a breath. If you don't see the chest rise, adjust the head 1 time and try again. If you see the chest rise that time, great, give another breath. Even if you don't see the chest rise, give another breath anyway, but don't keep trying to do breaths until you see the chest rise. Compressions, if we have to prioritize things, compressions are more important than breaths, okay? So head tilt, chin lift. For a child younger than 12 months, you're covering their nose and mouth. Normal breath in. Normal breath out. See the chest rise again. And then you're going right back to compressions, okay? If for some reason the infant is a big child and you can't cover your nose and mouth with your mouth, you're actually only covering their nose. It has to do with the anatomy of children, yes, less than a year old. And actually the direct line to their lungs is through the nose. So if for some reason you couldn't get that breath into their nose and mouth, it would just be their nose, which I can't do in this mannequin because there's no holes, but okay. All right. So now I'm going to come out of, we're going to put this all together and I'm going to come out of the full screen. All right. I'll give you guys a different scenario and I want you to answer the different scenario in the chat while we go through this. Okay. How hard do you inhale? Normal breath in, normal breath out. It's like, you know, when the doctor checks your lungs when you go to like a well visit, kind of like that, like maybe more of an exact, right? Like, but like, it's still just normal breath in, normal breath out. You're not forcefully pushing air into the lungs. Okay. No problem. Okay. So I'm going to put this all together. I'm going to give you guys a scene, use the chat to respond. All right. And I'm not saying this so that we're calling out people who are wrong, right? I'm saying it because the more you all are answering these questions, the more it's going to stick for you. All right. Okay. So this time we're at a playground. Okay. I'm at a playground. And all of a sudden, I hear a bunch of people screaming and running over to the splash pad area. And when we walk over to that area, there is a child on the cement who looks like, you know, something happened, right? This child looks to be about 11 months old, all right? Not entirely sure, but if I had to guess, I would say 11 months, right? What am I doing first? Make sure the scene is safe. Good job, you guys, right? So this is where you're looking around. Like, did something break? Did something happen, right? Like, is it safe for you? Are they near the sprinkler and you actually like need to move the child away from the sprinkler, right? I think I said a splash pad. Check and make sure the scene is safe. Okay, you go over the scene safe, right? They're not close to water. There's nothing on the ground. You know CPR, right? You know, you say, I know CPR, I can help, right? Then what are you going to do next? So you check to make sure the scene is safe, it's safe. Check for responsiveness, right? Baby, are you okay? Are you okay? Tap their shoulders, you know, tickle their feet, rub their chest. This baby is unresponsive. What am I doing next? Someone call 911. There is a huge crowd of people now around this child. What am I doing? Point to someone. You in the white shirt, call 911. Great job, you guys. Okay, now what am I doing next? Somebody's calling 911. Before I do CPR, check for breathing, check for breathing. Great job, everybody. How do we check for breathing? Look, listen, and feel. Oh, you guys are so good. Looking with my eyes to see the chest rise, feeling with my cheek to see if I can feel a breath, and listening for breathing. This child is breathing. What do I do next? Nothing. Good job, right? So I'm not performing CPR. 911. Ooh, great. We're the video is very happy about this. 911's already being called. I'm not performing CPR because they're breathing. This is a scenario where I'd stay next to this child, right? Keep an eye on them, assess them every few minutes to make sure they're still breathing. Okay, so I'm going to stay next to this child. You know, maybe reassure the mom, right? Talk to 911, but this child is breathing. There's nothing that we need to do. Okay, while I'm sitting next to this child, I notice that they stopped breathing. Now what do I do? We're not shocking anybody. They don't need to be shocked. They're breathing. What are we doing? CPR. Exactly. Okay. So I'm watching them, they're breathing. And then all of a sudden I notice like I'm looking at them. I haven't seen their chest rise. I'm feeling no breath, right? So they're still unresponsive because we already checked for that. They stopped breathing, right? So now I'm going to perform CPR. I'm going to do 30 compressions to 2 breaths. 1, 2, 3, 4, 5, 6, 7, 8. 2 fingers just below the breastbone. I'm letting this chest come back to its normal shape. Every time that I compress, I'm pushing hard and I'm pushing fast. 29, 30. Head tilt, chin lift. I'm covering what with an infant? Nose and mouth, nose and mouth. 1, I saw the chest rise. Saw the chest rise. I'm going back to compressions. 1, 2, 3, 4, 5, 6. Okay. All right. Couple things. 1, you're performing CPR until the person either becomes responsive or starts breathing. In which case, when they do, you're stopping CPR and you're staying with them just like we did when we came upon this child and they were unresponsive, but they were breathing. Okay. So, you're just going to stay next to them and keep an eye on them to make sure that they don't become unresponsive or stop breathing again. All right. If they do, you're going to go back to performing CPR if 911 hasn't arrived. So you're either performing CPR until they start breathing or become responsive, or until help arrives and they take over. Once, like when you see the ambulance pull up, don't stop CPR. Continue doing CPR until an EMS person comes over and actually says, like, I will take over for you now. Okay. So we're going to get into choking in just a second. Great question. I'm going to get there in one sec. So you're going to perform CPR until the person becomes responsive or starts breathing, or until help arrives and they take over. Okay. Otherwise, you're continuously doing 30 compressions to 2 breaths until help arrives. Okay. So you may be doing it for several minutes. How do you stop CPR to check if they're breathing? You don't stop CPR. Like, you don't stop CPR to check if they're breathing. You're going to do, so each round is 30 compressions to 2 breaths, right? After that round, you can look, listen, and feel for breathing again, right? If they're not breathing, that's how often you're going to check. After 30 compressions to 2 breaths, each round, after you do 5 of those, right? You can check, look, listen, and feel. They're still not breathing. You're going right back to CPR. Okay. Sorry, Daryl. I thought you were asking about choking. I'm going to come to that in a second. If an infant is on a soft surface like a crib, I would take them, if it is a infant or child that you can physically pick up and put on the floor, I would. Right? Like if it's a large adult that you can't safely get out of a bed, I would leave them on the bed and do CPR from the bed. Okay. Okay. All right. How are we feeling? Guys feeling okay about the infant? Okay, great. Now I'm going to show you what to do for a child. All right. And then we'll put it all together. So let's come back here. All right. Bring my chat back. All right. So we went through that. There's some songs that we can play. Has anybody seen the Office episode where they do the CPR in, The Office? Yeah, you got it. If you haven't watched it in a while, like following this class for a little comedic relief, if I had time, I would play it for you. Like, just if you need to just laugh after this course, because I know it's heavy. That is that clip. It's only 3 minutes. It's the funniest thing. But there are songs, right? So if you're wondering what 100 beats per minute is, can't stop the feeling, staying alive, staying alive, staying alive. That's the beat. That's 100 beats per minute. Okay. All right. Great. Okay. So, sorry, before we go into CPR for children, I want to talk about choking for infants, right? So again, infants are defined as children younger than 12 months, right? The first thing you need to know related to choking is the difference between mild choking and severe choking. Basically, like mild choking just means that the infant can breathe. They're making noises, they're coughing with noise, they're crying, you can hear crying, right? Like you can hear them breathing. They might look uncomfortable, but they're making noise, okay? Severe choking is that they can't breathe, right? So severe choking is actually a silent event. So they're coughing with no sound. They're crying with no sound, right? They will, if they're truly choking, they will start to turn blue. It usually starts around the mouth. So you'll start to see discoloration around the mouth, right? If a child is choking, what you want to do, severely choking, what you want to do is act fast, right? Because it's only a matter of time if they're not breathing that they will become unresponsive, okay? So mild choking, they're coughing, they're crying, you know, maybe they're gagging a little bit. You're just going to stand by them. You're going to let them cough, right? If you can visualize the object, like you know what they're gagging on, if you can see it, you can curl one finger, it's a hook, one finger into the mouth like this and pull that object out, but never blindly poke. Don't stick your finger in the mouth if you can't see something. That can actually lodge the object into the trachea and cause them to choke, right? But if they're mildly choking, they can move that object. You can see it, you can pull it out. If you're concerned about their breathing, even with mild choking, call 911. Okay. But really you're just standing by them and watching them and letting them work it out. Kids have, babies and young children have a gag reflex that's further up in their mouth. So they're going to gag sooner than us as adults. It's a good thing. That's actually like, I know it freaks parents out when kids gag, but it's actually a safety response to prevent them from choking. Okay. So gagging is a good thing. All right. I'm going to get to my thoughts on the life back in just a sec. With severe choking, you want to act quickly, right? So they're coughing with no sound, they're crying with no sound, maybe even they're starting to turn blue a little bit, all right? And so what you're going to do for an infant who is choking is you're going to do what we call back slaps, and then I'm going to show you how to do it, and then chest thrusts, okay? So what does it mean? So let's say you have this, it's 11-month-old infant in their high chair. You are sitting with them and you saw this object like that they were struggling with it for a second, and now like it looks like they're trying to cough or cry and there's no sound coming out. They're severely choking. You're going to pick this infant out of the high chair, right? At the same time, if you're with, I don't know why there's a thumbs up. If you're with someone, you're concerned about their breathing, they're severely choking, have them call 911, okay? You're going to support their head and neck along the jawline, right? So this bony part of the jaw is what you're holding on to. So grab onto the jawline, along the jawline next to the ears, right? Like this. Flip them onto their stomach on your forearm with their head facing down. So using gravity to your advantage, okay? Then you're going to take the heel of one hand and you're going to do 5 back slaps right between the shoulder blades, okay? So heel of your hand, 1, 2, 3, 4, 5. If the object does not become dislodged with the 5 back slaps, you're going to roll this child over onto the other forearm, support their head and neck, again, like right next to the ears, right? So I'm holding this head right along the ears, okay? And then again, keeping the head downward, I'm going to do 5 chest thrusts using 2 fingers in the same place as where we perform CPR. 1, 2, 3, 4, 5. Flip them over if the object does not become dislodged, and it usually doesn't with the chest thrust, it usually does with the back blows. You're going to flip them back over and do another 5 back slaps. 1, 2, 3, 4, 5. On this 5th back slap, you hear a splat on the ground. This child is screaming. The object has become dislodged, right? So you're going to repeat that cycle either until the object becomes dislodged, and you'll know that child is going to scream, is going to be screaming, right? And crying. Or until the child becomes unresponsive, okay? And you'll know that they've become unresponsive because they're going to go limp in your arms, all right? And when that happens, because you already know they're not breathing, right? And because they become unresponsive, you're going to lower them to the ground and you're going to start CPR because you know they're not breathing and you know they've become unresponsive. Okay. So you're going to continue to do that until either object becomes dislodged or they become unresponsive and you initiate CPR. Okay. I'm going to come out of shared screen so you can see me do this and answer your questions. 1, thoughts on the life fact. Number 1 question that I get asked. I'm not opposed to the life vac, but the life vac should never take the place of you learning this skill. You should also never walk away from a choking victim to get the life vac, right? Because again, we're talking like severe choking, you want to act quickly. So if there are 2 people there, right? And one person is doing the back blows and the chest thrusts and the other person goes and gets the life vac, fine, right? But that should never take the place of it being your first response or the skills of you actually learning how to do it, because if you don't have it with you, then you still need the skills. Okay. So I'm just more of a fan of learning the skills. Second question that I almost always get asked is, if the child is severely choking and you have to transition to performing CPR, is it worth doing breaths because you know that they were choking? And the answer is yes. I would still do breaths on this child because you don't know if 10%, 20%, 30% of that air is going to get around the objects into the lungs. You're likely not going to see the chest rise, but that's okay. Still do the breaths. Okay, because you have no idea how much air is actually getting into the lungs. And the reason why we're holding the head down towards the ground is because we're trying to utilize gravity to our advantage, right? So if we already have gravity to our advantage and I'm doing back slaps, it's going to help move that object in the direction that I want it to move. Okay. All right. Chest thrust. So the purpose of the chest thrust is similar to actually the Heimlich, where we're just trying to create force behind that object, where it likely won't become dislodged when you're doing it might become a little dislodged when you're doing the chest thrust. It might not be enough where the child cries, but it can loosen it up enough that when you go to do the back blow, it might come out on that first back blow. Okay, so we're just trying to create force from two different positions to try and dislodge that object as quickly as possible. All right. Is it safe to do the CAR if the baby still has the object? Sorry, is it safe to do CPR? Yes, it's safe to do CPR. You're doing CPR, okay? If they're too big to lay on your forearm, so depends on the age of the kid. I'm going to get into children in a second, but you can kneel down or sit down and use your leg as, if they're too heavy. So sit or kneel and then place the child on your leg to help support the weight of the child. Okay. Okay. We good? Great. All right. So, quickly show you guys the back blows and the chest thrust again. Okay. So the child sitting in their high chair, they start severely choking. They're coughing with no sound, crying, and I can actually see that their lips are starting to turn blue. I quickly pull this child up. I yell at my husband to call 911. I hold their head and support their head and neck with my fingers along their jawline. And I do 5 back blows. 1, 2, 3, 4, 5. Turn them over onto my other forearm, still holding the head with my hands. 2 fingers right below the breastbone. 1, 2, 3, 4, 5. Flip them back over. 5 back blows. This child becomes unresponsive in my arms. They go limp. I lower this child down to the ground and I move into CPR. 30 compressions with 2 fingers, right? 28, 29, 30 to 2 breaths, covering their nose and mouth. Okay. All right. All right. So that's what to do with a child. That's CPR and choking for an infant. Now let's talk about a child. And I'm just going to point out the differences, you guys, because the whole process is actually the same with the exception of only 2 things, all right? Which is why I repeat myself over and over again, because it's the same for infant, for children and adults. All right. So for children are defined as a child 1 to about 9 years old. The only reason why these definitions exist, you all, is to decide whether or not to use 2 fingers, 1 hand, which is what we use for a child, or 2 hands, which is what we use for an adult, okay? The only reason why it changes from 2 fingers to 1 hand to 2 hands is based on how hard you can push on the chest. So if it's a big kid, maybe you are actually using 2 hands because you can push harder with the 2 hands than the 1, right? That's the only reason why these exist. So CPR for a child, the things that are different here, you guys, are in red. So let's say, again, you are at the park and somebody starts screaming and you walk over and it looks like it's a kid anywhere between 5 and 8 years old, right? On the ground, right? So the first thing you're going to do is make sure the scene is safe, right? The next thing you're going to do is try and get a response out of that. Hey, are you okay? Tap their shoulders, rub their chest. They're not responding, right? Because they're not responding, you, in the blue shirt, call 911, right? Now I'm going to look, listen, and feel for breathing, right? So still the same with the child. I'm going to look at the chest. I'm going to listen with my ear next to their mouth. I'm going to feel for breathing next to their mouth, okay? If they have on any bulky clothing, you can try and pull that off, right? If they're not breathing and they're not responsive, all right, what am I going to do? This child's not breathing and not responsive. What are we doing? CPR, good job. All right, the only difference in CPR with a child than an infant is you have the heel of one hand is how you're performing compressions. So you're still lining up the nipple line just below the heel of that hand, and you're still pushing hard and fast, right? Notice how it says push straight down for 2 inches. It's still hard and fast, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Still letting your hand come off the chest to allow that chest to go back to its normal shape. 29, 30. Still doing 30 compressions. Still doing a head tilt chin lift, but with a child and an adult, you're pinching the nose and you're giving the breath through the mouth. Still 2 breaths, normal breath in, normal breath out. Look for chest rise, go right back to compressions. Okay? Same rules apply. If you're alone and have your phone, you're calling 911. If you're alone and don't have your phone, you're doing 5 sets of 30 compressions to 2 breaths before going to get your phone. Okay? You're going to continue CPR until when? How long do you do CPR for? Don't lose momentum now until a medic takes over, until they become responsive, or until they start breathing. Good job. So they start breathing, they become responsive, or EMS shows up and takes over. Okay. Just to come into the big screen here, just to show you guys the compressions on a child. So child, still the nipple line, we're putting the heel of our hand just below the nipple line. Right. So right here, still pushing hard and fast. 1, 2, 3, 4, 5, 6, 7, 8, right? Head tilt, chin lift, pinching the nose and just covering the mouth. Normal breath. You can look for chest rise. Okay. All right. One note that I want to make before I go into choking for a child, and then I'll quickly just show you guys CPR and choking for an adult, is if you come up onto, so one of the times that I've given CPR, I did actually come up to somebody on the sidewalk. There's a crowd of people around a person. I walked over to see if everything was okay. This person was blue. Like I already knew they weren't breathing or responsive before I even checked. But it looked like a likely overdose, and the person had a nosebleed. I did not know this person. Okay. So I didn't do breaths. So you always have the option to do, they call it hands only CPR, to just do compressions. So if it's a stranger, right, and you don't know them, you do not have to do breaths. In that specific scenario, they were actually with somebody who knew them. So I asked if they were willing to do breaths, and that person did it. So you can always ask somebody who's with them if they're willing to do it. But otherwise, you're just going to do compressions, and you'll just continuously do compressions without stopping until they either become responsive or help arrives. They start breathing, become responsive, or help arrives. Okay. So, sorry, what was the question? Pinching to close the nose. Yes, you're pinching the nose to close it so that all the air is going through the mouth. Yes. Okay. All right. Okay. Everybody feel good about CPR for a child? With a child, it's 2 inches. But again, you guys don't get too hung up on the depth. It's just hard and fast. Okay. So just 1 palm, hard, fast. Okay. All right. All right. Let's talk about choking in a child. So same thing, you guys. We're looking for mild choking versus severe choking, right? Mild choking, when somebody's mildly choking, what do you see? What are some signs that they're mildly choking versus severely choking? What do we got? They're making noise. That is the biggest one, you guys. They're making noise. Okay. If they're making noise, then they're not severely choking. All right. So mild choking, they're making sounds, they're coughing loudly, they can breathe, maybe they're even crying, they're gagging, right? Like that's all mild choking. Severe choking, they cannot breathe, they're coughing with no sound, they're looking blue, they're crying with no sound. older kids, like I started teaching my kids the sign for choking as early as 5. Probably even younger than that, you can do that, right? But the universal sign for choking is this. So maybe you have an older kid who does this. I don't know if anybody's seen, has anybody seen the video of the twins in the cafeteria? It was a brother and sister, and the brother was choking on a piece of cheese, and he went up to his sister and tapped her and went like this, and she knew he was choking and gave him the Heimlich and saved him. Has anybody seen that video? It's a very, you're all going to see it now because your phones are listening to me, but it's a wonderful video. So teach your kids the universal sign, okay? For mild choking, again, we're standing by them. We're encouraging them to cough, right? If you can visualize the object, you can do a hook and try and scoop it out, but you're never blindly poking. If you're concerned about their breathing at all, you're calling 911, okay? You're not telling them to raise their hands. You're not hitting them on the back, right? People love to pat people on the back when they're choking. Don't do that because if somebody isn't expecting that, they're going to go, and that's going to cause the object to get lodged, right? You're literally just standing next to them like, you're okay, I'm right here, cough, right? Maybe like some kids even throw up when they're choking. That's okay. The object comes out, all right? But never blindly poke and no need to touch them, all right? Severely choking, they're coughing with no sound, they're crying with no sound, right? Maybe even starting to turn blue, you're gonna act quickly, right? And so for children, again, if they're older, an older child and an adult, you can ask if they're choking, right? You can let them know that they're gonna help, that you're gonna help if you say yes. For a child, so again, people love to have the definition be like an infant is younger than 12 months. A child is 1 to 9. The child has to be able to stand in order for you to do the Heimlich the way I'm going to show you, right? So if you have a child who can't stand, like they, it's a 15-month-old who isn't walking yet, then you're going to do the back blows and the chest thrusts, right? If it's an older child or a child who can stand, you're going to kneel behind them or have them stand between you while you sit in a chair, okay? And you're going to take your fist. You're going to make a fist, tuck your thumb into that fist, and with the knuckle of your thumb, you're going to place it into the soft spot on the belly between like the chest bone and your belly button. So like feel for it right now on yourselves. Here's your belly button. Here's like the bottom of my chest bone right here, that soft spot, right? At the bottom of your rib cage. And so you're going to make a fist. You're going to put it in that soft spot. You're going to cover it with your other hand, and you're going to lift in and up. In and up, okay? And the idea here is you're creating force behind that object to help dislodge that object, right? So I'll come out of the shared screen to show this to you guys. So you're making a fist, place your thumb inside the fist. The knuckle of this thumb is what's going on the soft spot between the belly button and the rib cage, so right here, okay? If this is a child, you can sit down with them between your legs. You're going to take your other hand and put it over the fist, and you're doing in and up to try and dislodge that object, okay? You are doing the Heimlich on a child until one of two things happens. What are those one of two things happening? Do the Heimlich until when? Either the object becomes dislodged or what? What's the other scenario? You get a response. So if the object becomes dislodged, you're going to get a response. What's the other scenario? Yes. They lose consciousness. They become unresponsive. They're going to go limp in your arms. They're going to go to fall to the ground, right? You're going to have to lower them to the ground. Okay. So one tip that I like to tell people for children is if like kneeling behind them can be helpful, because if they did become unresponsive, you can easily lower them to the ground. Or for adults, which I'll show you in a second, stand and put your one leg between their two legs. So if they become unresponsive, you can lower them to the ground, okay? So you're doing the Heimlich until they become unresponsive, and then you're gonna perform CPR or until the object becomes dislodged, okay? Oh, no problem, Alicia, I'm sorry. I know we're running a little bit over. I'm so sorry, you guys. I talked for too long in the beginning. For those of you who can stay. I'm gonna just talk about adults quickly, okay? All right. Any questions about choking in children? Okay, I'm just going to stay in the big screen here, and I'm just going to show you the differences for adults. All right.
Hey, Jamie, I don't mean to cut you off, but somebody said for the older child, so don't slap them on the back. None of that, correct?
No. Yeah.
Okay.
You're only doing back blows for the infant when you know they're severely choking. A child, nobody mildly choking, you're ever hitting on the back. For a child that can walk, you're doing the Heimlich. For a child who can't walk, you're going to do back blows and chest thrusts.
Okay, thank you. I just thought that was a good question. Thanks for
That was a good
asking.
question. Thanks. Okay. Quickly, just for adults, you guys, again, just pointing out the differences. Only difference for adults is you're using 2 hands instead of 1. So 2 hands, again, same spot, in line with the nipples, just below the nipple line. Okay, hand just below the nipple line. You're pushing hard. Again, for adults, it's 2.5 inches, but it doesn't matter. It's just hard and fast. 1, 2, 3, 4, 5, 6, right? 28, 29, 30. For an adult, you're still doing the head tilt chin lift. You're still pinching their nose and you're covering their mouth for the breath. Normal breath in. 2 breaths, back to 30 compressions. Okay. So the only difference between a child and an adult is that you're using 2 hands and you're pushing harder, but it's still pinching the nose and covering the mouth. Okay. An adult who's choking, so ask them, are you choking? Right? Same signs, but you can actually ask an adult if they're choking. If they're choking, you're doing the Heimlich. You're doing the exact same way as a child, except you're usually standing. So you're making that fist. The knuckle of your thumb is going into that soft spot. You're bringing it around. I like to put one leg between their legs, and you're still pulling in and up. Okay, that's the Heimlich. For a couple considerations for adults, one would be a pregnant person. You're then putting, if they have like a clear pregnant belly, you're putting the knuckle of your thumb above their actual pregnant belly, so just a little bit higher on the chest. If you're home alone and you're choking, what you're trying to do is actually throw this part of your body, so using the force, the weight of your body to throw it up against the edge of something that's about this height. So that might be a bar counter height, that might be the back of a chair. But you're trying to create that force yourself on an object in your home to try and dislodge the object. Or if it's somebody who's like significantly taller than you and you can't get your hands in the right spot, ask them to kneel. Don't you step on a chair, that's dangerous, right? Ask them to kneel and then perform the Heimlich behind them. Okay. What do we have? For 2-year-olds, is it safe to give them nuts? Somewhere says it's a choking hazard. So anything that the top 2 choking hazards for children are hot dogs, 3 hot dogs, grapes, and popcorn. So cut grapes in half. Hot dogs, same thing, cut in half if you're going to give it to them or into small pieces. Popcorn, the recommendation is actually just not to give a child popcorn until age 5 or older. So those are the 3 things. Nuts, I can see why people would say that. Anything that's about for infants, right? Kids like less than 12 months, anything, bigger than the size of like a chickpea-ish, slightly bigger than that, could potentially be a choking hazard if they don't fully chew it. For a female adult, that nipple line may be different for everyone. Is there? Okay. So yeah, great question, especially as somebody who's had 3 kids. Just think about like where the nipples would normally be, right? Not necessarily like you're thinking about, even if it's easier for you to think about like the armpits, level with the armpits, then just do that. All right. But where you would expect them to be on a mannequin. Sorry, Chrissy, I'm going over. I'm going to stop my story.
No, you're totally fine. Totally fine. This is all great information. I was honestly just coming on just to say that we did have one question in the Q&A that I think is pretty important, so I'd like to ask it.
Great.
It says, for a petite toddler under 20 pounds and close to the infant age, would you consider them a child or an infant, or does weight not matter?
I mean, I would consider that an infant, just because, again, you're thinking about how easily can you pick them up and do the back blows or the chest thrusts, right? So that would be a kid who you can more easily do that. And or like how much force you would need to perform CPR with compressions. And with a smaller child, you don't need as much force.
Mm-hmm. Okay. Yeah. So kind of use your judgment on, yeah. Okay, great. Yeah.
But again, you guys, like, doing it not correctly, right? Bad CPR is better than no CPR at all. A bad Heimlich's better than a no Heimlich or back blows at all, right? So just do something, okay? Life hack I already talked about. How effective is the Heimlich for choking? It's not going to work every time. It all depends on how deep that object is dislodged. But if we can dislodge it, like if it is an object that's going to be able to be dislodged, it is a very effective tool. It's more so like trying to get that object out as quickly as possible. And if you can't, then just transitioning to CPR. Okay. And then when EMS arrives, they can more accurately assess the situation to figure out how to get the object out. Okay. All right. I feel like I need to just stop probably with the questions, unless you want me to continue going, Chrissy. Totally up to you, your call. But I hope that this was helpful for you all. The intent of today was for you all to leave feeling more empowered and more confident. And even though this is, you know, stressful and a heavy topic, to feel like you're coming out of it with something new that you gained, even though this is really scary. It really was to give you the skills to be able to respond in an emergency. So I truly hope that that's what you're leaving with today. Feeling more comfortable, feeling more confident, feeling more empowered, and being able to respond in an emergency. And hopefully it's not my voice that you hear in your nightmares tonight.
Thank you so much, Jamie.
No
Everyone is saying
problem.
thank you, so great. Honestly, this was so helpful as somebody who worked in childcare. We had to get CPR certified every 2 years. Being in center for so long, guys, it's always helpful to have these like refresher courses, because even for me, it's like if you don't use it, you lose it.
Yes.
So absolutely, thank you so much just for myself too, Jamie. That this was great
And I put our
refresher.
Instagram handle in there for people who just like want to learn more about this or other topics relating to parenting. It's at Nurture by Naps is our Instagram handle, or just our website, www.nurturebynaps.com. We have like, if you have a grandparent or family member or caregiver who you want to take this course, we offer this course monthly. So you can take it live virtual. So that's another option too, in addition to a whole bunch of other courses. But just wanted you guys just to have some resources to leave with today. I will send the notes to Chrissy so that she can get all of those out to you. And then Chrissy will send out the link for the equivalent in Canada for anybody who's looking for those trainings in Canada.
I sure will. Thank you so much. And thank you everyone today just for your interaction and your in the chat. It was awesome to kind of have that feature and be able to have like a live conversation and questions. So thank you so much to everyone. We'd like to remind everyone that there will be a recording sent out today, as well as those helpful resources that we just talked about. And then there's also going to be a survey popping up when this talk ends. So if you just take a quick minute to provide us and Jamie with some feedback, we'd really appreciate it. Jamie, thank you so much again. Thank you everyone for joining us, and we'll see you next month, October 15th, for our next Kidco Talk.
Awesome. Thank you again so much, Chrissy. And for you all, you brought the energy. Love it. Bye, you guys.